Jennifer Puselski, and I am presenting type 1 diabetes for the oral presentation. How many of you are uncomfortable with needles? What if you had to use a needle on your everyday life to inject medicine? My 7-year-old daughter was diagnosed with type 1 diabetes last May 12th of 2014. It's almost a year now. It's very devastating. My father passed away with it as well. Diabetes is costly, complex, and devastating chronic illness that possesses a major public health problem. It affects 4,500 children in Wisconsin alone. Now let's see, what is type 1 diabetes? Mama, it's rare. It's only 5% of people with type 1 diabetes. They're mostly diagnosed in children and young adults, and was previously known as juvenile diabetes. The immune system attacks and destroys cells in the pancreas that produces insulin. In type 1, the person has either completely stopped making insulin or only makes a very, very small amount of that hormone. Now, who gets diabetes, or the type 1 diabetes? It's actually more common in whites than African American, and it's very rare. Only 5%, as I've said before, 5% of the population only gets it. It affects men and women equally, and starts with people, and also actually starts when you're like under 20 years old. Now, what causes it? Actually, even doctors doesn't know all the things that lead to type 1 diabetes. Genes play a major role. They also know that type 1 diabetes can result when something in the environment, like a virus, tells your immune system to go after your pancreas. And most people with type 1 diabetes have signs of this attack called the autoantibodies. They're present in almost everyone who has the condition when their blood sugar is high. What are the symptoms? Here are the symptoms that we have here. Heavy thirst, which was experienced by my daughter, increased hunger, dry mouth, nausea and vomiting, pain in your belly, frequent urination, and unexplained urination, which she also experienced like bedwetting at night. She never does that. She's 6 years old. Unexplained weight loss, fatigue, blurred vision, which will happen probably in the later years. Heavy labored breathing, urinary tract infection. Urinary tract infection is actually the reason why we got diagnosed with it. We went to the doctor because of this. She was having itchiness in her, down there in the bottom, and we went to the doctor, and automatically they said it's type 1. Well, what is the signs of emergency with type 1? Shaking, confusion, rapid breathing, fruity smell of breath, which I also noticed with my daughter, pain in the belly, and lost consciousness, which is very rare. And we don't want that. That's a real emergency. Now that we know who can get type 1 diabetes along with its causes, symptoms, let's continue to educate ourselves with how it is diagnosed as well as its treatment. The doctor will check for your blood sugar level. They're gonna ask you to make a urine test for glucose or chemicals. If blood sugar is high upon testing and urine showed a lot of glucose, then that's it. Unfortunately, it is confirmed you have type 1. I argued with the doctor even, but it's irreversible, and there's not a way to present or to prevent type 1 diabetes once they figure out that you got a lot of glucose in your urine. How is it treated? Keep blood sugar in the range the doctor gives you. Normally, it's 80 to 150 for my daughter. And if you're below 80, then it's low, and if it's 150 and above, then you have to correct that with insulin. You have to inject. Checking often and adjusting the insulin, which is very often what we do. And lifestyle change, food, The intake should be minimal now. We have to weigh it. We have to weigh everything that she eats. She can still eat whatever she wants to eat, but we have to be on top of it. Exercise and discipline, and must use insulin injection to control blood sugar. Not keeping type 1 diabetes well controlled could end up to serious or life-threatening problems. Here, we should see, this is my daughter. Her name is Tia. And at age, this is probably like a couple of weeks after she was diagnosed, and she was attending to herself. She is giving her own insulin already. She is testing with a smile. And yeah, that's the insulin in the picture that we use. It's Humalog for blood sugar. And for her long-acting one, it's Lantus. We could have, they can experience retinopathy, kidney damage, or poor blood circulation and nerve damage. Unfortunately, some diabetics can get amputated because of the poor blood circulation and nerve damage. Now, to make this presentation probably more interesting, there's a video that I found on YouTube, and it says a guide for children. Because we're dealing about type 1, it's mostly children who's affected by this illness or ailment.
Good night. Sleep tight.
I'm sorry, let's do it again.
Good night. Sleep tight.
Why me?
What's up?
What are you?
I'm me. I'm here to help. What's up?
I'm trying to work it out. I've got type 1 diabetes. I just want to know what it all means.
That's why I'm here. I know all about diabetes. Let's go inside the body and see what's happening. Your body's made of cells powered by glucose, which gives you the energy to play and run and grow.
Glucose, where are you?
What time you call this? I'm waiting.
Waiting.
Your stomach breaks down carbohydrates from some foods like rice, bread, and sugar to make glucose. And this travels in the bloodstream to your cells.
Glucose, where are you?
The glucose needs something called insulin to unlock the door to your cells so it can get in. Your body makes insulin in the pancreas, which is just below your stomach. When you have type 1 diabetes, your body doesn't make any insulin. It's not because of anything you or your parents or anybody else did. It just happens. When the cells can't get any glucose, they feel very tired and can't do things like they used to.
So tired for 40 weeks.
The body starts to break down fat to get energy and might lose weight too. The body decides there's too much glucose, so it tries to get rid of it by making you pee. Peeing a lot makes you thirsty.
The cells really need glucose. How can I get it?
Like what you see, the cells really need glucose. And it's a very interesting video. My conclusion for this oral presentation is this. This is very personal to me. And it's really sad that I was kind of emotional to present this topic. There's no cause or cure for type 1 diabetes. Parents and patients often ask if something they did caused diabetes, and the answer is really no. Type 1 diabetes is the insulin-dependent kind. There's no way out of the situation. If we have a child or relative with type 1, the best option that we have is to help them and give them the proper care they need in order for patients to get through it day by day. It's not an easy task, but it's not impossible for them to live. It is not impossible for them not to live a normal and happy life, even though they are living with diabetes. Thank you very much for coming here and listening to my presentation. I hope that by now, at least after hearing my speech, you guys have a better understanding of what juvenile diabetes is all about. Thank you. Have a wonderful day.